Hey there, Best Day family. Just wanted to talk a little bit today about our stroke and traumatic brain injury rehab program here at Best Day. Here we are doing what is called a mirroring technique. This is an amazing way in which to teach the part of the body that has been affected by a stroke how to relearn a movement pattern. We have a rolling mirror and we put it midline of Todd's body. This is Todd working with Sydney, our best method personal trainer. And we're doing a mirroring technique. And once you put the mirror in the center of the body, Todd is going to look at his reflection in the mirror, and it is going to basically kind of hack his brain into thinking his right side is moving. So after a stroke or traumatic brain injury, one side of the body is usually greatly affected, oftentimes slight bit of paralysis and weakness in that side of the body. So we're using the unaffected side to retrain that affected side how to learn the movement pattern again. So Todd can see this visually. This is great data that his brain is receiving. The left side of the body is teaching the right side the movement pattern again. And then Sydney is simply just kind of assisting him through the movement so he can start feeling what that feels like again. So it was really neat to watch this in action. Sydney afterwards was mentioning that he was already increasing his ability to hold that arm up just after a few repetitions. So it just shows how powerful our brain is when you give it the right response or the right stimuli. So tapping into our visual field is a great way to do that, and mirroring allows you to see that in action. So this is a great way to try a different technique that would be something a little bit different than a lot of traditional therapy for stroke and traumatic brain injury. There's a lot of research that shows how effective this is. This works for upper and lower body. So we will later in the video kind of show you the lower body exercise as well. So Todd had his stroke back in April 2019. He's been coming and working with the Best Method personal trainers here at Best Day for about 8 months now. We had to take a little hiatus over the COVID quarantine, but now he's back in full swing and really excited to get back. Sydney is here showing him how to get that arm up, and Todd can see his reflection in the mirror. So this is really neat technique that we implement at Best Day. So this is kind of neat here. Sydney's showing him how to do a little bit of abduction with the shoulder, and you can kind of see from Todd's perspective here as we come around, and he can kind of see that arm lifting and lowering, so his brain is seeing that connection being made, and it's really cool to watch. Todd was super focused. One of the cool things about Todd is he's so motivated and positive, and just he starts sweating because he's focusing so hard sometimes. So it's really cool to watch. It's definitely a good attribute to have if you've ever had a stroke. Having that positive attitude is going to make you progress a lot faster. It's pretty tough to do after you've lost the use of one side of your body, but watching Todd is just like truly motivational and inspirational every time he comes in. So that's the mirroring technique that we implement here at Best Day. I think Todd is now going to go sit down now and get into some lower body, so we can kind of show you that once we get him set up. Best Day Fitness has been specializing in stroke and TBI rehab since 2006. We have a very unique barefoot. It's one of the only ones in the world that is a concentrated stroke rehab program in which we do barefoot training, and we focus on posture correction and also kind of involving recreational therapy, sports rehab, lots of different techniques to keep the stroke survivor motivated, doing things they love to do. Last year, we had a young lady with a spinal cord and brain injury that loved to do Legos, so we did a lot of Lego projects with her, and she loved it. So just we like to find things that people like to do. It's more fun for them. So now we're kind of going into some lower body here. You can see how he's doing some knee extension And also Sydney is helping him with dorsiflexion and plantar flexion with his ankle and foot. And then Todd can kind of see that mirror image as if it's his right leg. So this is a cool perspective. It kind of looks like he has two heads here, but it looks like he's got a functional right leg as well. So really, really neat example of how we use mirroring to retrain the brain on how to use that body part again. And what's happening right now is the left hemisphere of his brain, which was affected by the stroke, is relearning from the non-affected right hemisphere of his brain. So because the left hemisphere was damaged, the right side of all his physical attributes on his right side of his body are weakened, and that's what we're working on here. So it takes a lot of repetition to retrain the brain, but in the end, it does work, and it is an amazing process to watch. It never ceases to amaze me how the brain uses neuroplasticity to relearn these patterns. And on a side note, Todd is now driving again, so that's really cool. He passed his driving test and has modified his driving arrangement so he can operate a motor vehicle now. So he's getting his independence back, and that's one of the truly inspirational things that makes us love coming in and helping out fellow humans every day, get them back to living independently again. So that's something we specialize in here at Best Day. If you have any questions or comments, or if you or a loved one has been affected by a stroke or traumatic brain injury stroke or traumatic brain injury, we can definitely get you in for a complimentary evaluation and teach you how we can help you along your path. Thank you for taking the time to watch this video. If you have any questions or comments, feel free to reach out, and look forward to chatting with y'all soon. Have your best day ever.